If you ask people what they know about arthritis, most will say that it's a common ailment for seniors and it's caused by wear and tear of the joint. The belief is so widespread that anything said to the contrary sounds unbelievable. Hey, it's Glenn here from Mehab, the world's leading physical therapy alternative, where we educate and empower you to take control of your recovery. If you're new here, make sure you click that subscribe button, and all the links we mentioned in the video can be found in the description below. As always, this information is meant for educational and demonstrational purposes only. With that out of the way, let's get into it. Two of the biggest misconceptions regarding osteoarthritis is that they are a wear and tear disease, and that exercising does damage and will wear out your joint. The reality is that exercise has been shown to relieve pain and does not harm joint cartilage. So what contributes to the development of arthritis? Researchers found that low-level inflammation is the leading cause of arthritis. Our joints, when healthy, contain hundreds of chemicals and compounds that support cartilage health and healing. With chronic inflammation, cartilage weakens by thinning out, thus becoming less able to tolerate stress. This results in damage and inability to recover. Over time, the joint surface wears away to the bone-on-bone joint surfaces. However, bone-on-bone in and of itself does not guarantee it's the cause of your pain. Check out our video on knee MRI findings linked below to learn more. So is there any truth to the wear and tear belief? The short answer is kind of. Whether wear and tear occurs primarily is dictated by the health of the joint. An unhealthy joint has weakened tissue that has a lowered tolerance to stresses, which can result in damage to the tissue. However, it is the precipitating low-level inflammation that sets up the environment. Mechanical stresses such as having severely bowed or knocked knees can increase the incidence of arthritis, but generally only in the presence of an unhealthy and therefore weakened knee tissue or extreme variations from the norm. Having knee joints placing pressure on one side decreases the surface area where forces can be dispersed. It's the reason nails easily penetrate wood. The point of the focus of the nail exceeds the wood's ability to resist. This is why it's important to try and retain a meniscus and not have it removed. Every piece that is removed decreases the area available to disperse forces. Having slightly malaligned knees is not a big deal, as the tissue will adapt to the stresses, and there are millions of people without any symptoms but still having quote-unquote malalignment. So what contributes to the chronic inflammatory state? Body composition, increased body fat, and decreased muscle mass are some of the leading risk factors, and there is a correlation to weight, but not exactly. The association with weight and arthritis is primarily due to body composition versus actual weight. People can have high body weight with low body fat, as in the case of a bodybuilder. Additionally, people with low body weight can have high body fat percentages, placing them at risk for chronic inflammation. Higher body fat can result in a lower relative lean body mass, further stacking the deck for chronic inflammation. Other factors include decreased muscle strength, increased consumption of fats and sugars, decreased estrogen levels, increased testosterone, and decreased vitamin D. While there are some systemic diseases that weaken and destroy cartilage, such as diabetes, ankylosing spondylitis, and rheumatoid arthritis, many of the risk factors are within your control. Most of the risk factors can be addressed by lifestyle changes with nutrition and exercise. So what does exercise do in an arthritic joint? Studies have shown that exercise decreases the concentration of compounds that create an unhealthy joint. Our cartilage responds well to cyclic or on and off loading activities like walking or running. Exercise has been shown to improve pain levels, increase strength, and decrease muscle atrophy. Being sedentary increases inflammatory compounds in the joint and can be identified by pain and knee stiffness in the morning or after sitting for a long time. As soon as you start walking, the joints warm up, they feel looser, and you feel better. So what exercises should you do? Well, this is going to vary greatly depending on the severity of your arthritis/symptoms. Before we get into some general guidelines, we need to talk about using imaging for determining the severity of arthritis and symptoms. As mentioned previously in our video on x-rays and MRIs for knee pain, again linked below, they are not as reliable as everyone believes. Make sure you watch that video after this. Arthritis is present in pretty much anyone over 20, and prevalence increases with age. It is a normal part of the aging process. Imaging does not give the full story. People with little arthritis can have severe pain, and people with severe arthritis can have no pain, so take the results with a grain of salt. Also remember that without a previous image to compare it to, there is no point of reference to determine arthritis progression. How do they know you haven't had that arthritis for 10 years? Well, they don't. With exercise, the key is to start low and progressively increase the amount and intensity of exercise over time. To learn more about the specifics of increasing tissue tolerance, check out the link in the description below. Exercise choice and intensity will depend upon what the knee can tolerate. An arthritic knee with high tissue irritability and pain will need a different set of exercises than someone with mild arthritis or symptoms. There are a number of ways you can change the intensity of knee exercises. Exercises can be increased in intensity by adjusting variables including duration, level of weight bearing, speed, sets, repetitions, range of motion, and frequency. Rather than go over every exercise, we'll put up some videos of the best exercises for moderate and severe knee arthritis symptoms, which once completed we'll link below. The simplest thing you can do in the meantime is to start a structured daily walking program. If your symptoms are high, start low with 3 to 5 minutes of structured walking. If your symptoms are moderate, start with maybe 5 to 10 minutes of structured walking. The most important piece of the puzzle is to wait until the next day to determine if it was tolerated or too much. If you have increased symptoms at rest, take that day off and then try a lower time period once symptoms return to baseline. If you can tolerate it, stay at that level for a week before trying to add additional time to your walk. Every day you put off changing your nutrition and exercise habits is one more day in the wrong direction. Improved nutrition, exercise, and the associated changes in body composition all help decrease chronic inflammation levels and improve not only joint health but health in general. Exercise does not speed up arthritis. People who have arthritis should exercise daily, though people with severe arthritis may need some exercise modifications initially. Being active in any way is important to the longevity of you and your joints. Thanks for watching, and before you head out, please hit that like button, share us with your friends, and be sure to click that subscribe button and notification bell so you can see our best exercises for arthritis, and we'll catch you on the next one.